Remove the pad from the protective wrap. Examine the pad to be sure that it is free from defect. Use a thin layer of dressing or barrier when applying the cold pad to the area being covered. Apply cold pad to the affected area with the hose extension down the arm. Apply an elastic wrap over the cold pad. Do not wrap the cold pad so tightly as to restrict blood or fluid flow. Position the long strap around the torso, securing it in the front and back. Position additional straps under the affected arm and around the bicep. Connect the couplings on the pad with the couplings on the hose from the unit. Make sure both connections are properly seated. Listen for a click on each connector when they are pushed together. As a final check, pull on each coupling to see if they are secure. Unless both couplings are properly joined, water will not flow through the system and no cooling effect will be realized. Once all connections are secure and the device is ready, the power supply can be plugged into a wall outlet and then the back of the unit so that the patient can begin therapy. During device use, consult the instructions provided with the unit to answer additional questions that might occur. When the cold therapy treatments are concluded, remove the pad from the patient, disconnect pad from the hose, and discard. Note, a DonJoy cold wrap may be substituted for elastic wrap or can be applied over the elastic wrap.